Welcome to the first video episode of Path News Network Daily Edition from the College of American Pathologists. I'm Nancy Johnson. It's Monday, June 15th. Here are a few of the stories we're working on this week. CAP pathologists scored victories with the nation's largest physician organization. Why their growing influence at the AMA is translating into real results for the specialty and laboratories. Ebola cases are surging. We'll talk with the CAP's Dr. Ben Bradley, an infectious disease expert. He'll dig into testing and the challenges of this particular strain and the potential for spread of the disease. And a roundup of commencement speeches from pathologists and lab professionals this graduation season, from the inspirational to one that'll make you laugh.
Phones had cords. Maps were made of paper.
Today's story is on the use of race in medical decision-making, which is facing increased scrutiny across healthcare. Now the CAP is taking a closer look at whether race-based calculations should continue to be used in prenatal serum screening tests that help assess the risk of certain fetal conditions. This week, the CAP Pathology and Laboratory Quality Center for Evidence-Based Guidelines is bringing together experts from around the country for a symposium on the latest research and clinical experiences. They'll discuss what it could mean for laboratories and pregnant women. Dr. Keisha Mitchell-Richards chairs the CAP's Diversity, Equity, Inclusion, and Accessibility Committee and will moderate a panel at the symposium.
So, prenatal serum screening is a test that's run when a person is pregnant, and it is one of those tests that we use to decide if someone is at risk for certain types of abnormalities. And in particular, the one here that we're talking about is serum alpha-fetoprotein, which is going to be an indication for your risk of having a baby that has Down syndrome.
One question is drawing growing attention. Should a patient's race be part of those calculations? The CAP is developing a guideline to evaluate the evidence. The CAP's Dr. Ann Moyer of the Mayo Clinic co-chairs the guideline.
Yeah, so CAP became interested in this topic for several different reasons. So across medicine over the past few years, many organizations have been reevaluating the use of race in clinical algorithms in general. And then at the same time, questions were raised within CAP regarding the prenatal screening accreditation requirements and whether race should continue to be incorporated into the risk calculations. And so then those discussions actually prompted really a need for a rigorous review of the evidence and to get a better sense of how to answer those sorts of questions for laboratories that were inquiring.
Historically, race was included in some screening algorithms because researchers observed differences in average biomarker levels among patient populations. But experts say the science behind those assumptions deserves closer examination.
Yeah, so historically it was noted that some biomarkers had a higher or lower average concentration depending on the patient's race. And so then the goal was really to be adjusting for those differences and hopefully being able to achieve a similar screen positive rate, no matter what racial background the patient was from. But one thing that's really important to note is that the studies that were performed were not necessarily based on genetic ancestry, but rather on race. And race isn't necessarily a biological variable, and it can be defined in different ways, and so that really complicates the use of this variable.
As researchers have gathered more data, questions have emerged about whether race remains a meaningful factor in assessing risk.
So as we now reflect on it, there's data that shows actually that there is no difference. There may be other clinical parameters that you can use that are better. There are other tests that are better. But now when we reflect on the way we use race, we should be intentional and accurate. It should have value that we can easily trace and understand.
Dr. Mitchell-Richards says patients deserve to understand how these decisions are made and should be empowered to have honest conversations with their physicians.
So I think if someone comes to me as a minoritized pregnant person and says to me, this test shows that you're at increased risk, the question I want to ask as a patient is, did this test consider my race? Is that a valid consideration? And what is the meaningful difference that you would say to me if I were not Black? Is there a meaningful difference, and is that data holding up? The other thing I would want to ask is there a better test?
The Prenatal Serum Screening Symposium will be held virtually on June 19th and is part of a CAP initiative funded through a grant administered by the Council of Medical Specialty Societies to examine the use of race in clinical algorithms. You can find information on how to register in the show notes. The information from the symposium and the guideline under development will be shared with the CAP, including the Council on Scientific Affairs and the Checklist Committee. That does it for the Daily Edition. Be sure to share this newscast with your social media network. And if you've got a story that we should be covering, write to us at stories@cap.org. We're back tomorrow at 5 a.m. Eastern for another episode of the Daily Edition. I'm Nancy Johnson. Have a great day.